Hello everyone. In this session, we are going to discuss the important topic that is cervical precancers. So here in your university exam, you usually get a short question on this topic. So either you get a question on the CIN, that is cervical intraepithelial neoplasia, CIN 1, CIN 2, CIN 3, you get short questions on that. Or very frequently you get a short question on the Bethesda system, that is the latest classification of the cervical precancers, in which we divide the cervical precancers into two categories, that is LSIL and HSIL, that is high SIL and low SIL. So let's start the topic, that is cervical precancers. So here you can see we are starting an important topic, that is cervical precancers. We will see two main classification, that is CIN classification and SIL classification. Let's start it. So before understanding the cervical precancers, you must understand the normal anatomy and histology of the cervix. So we will start our session from studying the normal anatomy and histology of the cervix. After that, I will come on the topic, that is cervical precancers. In the cervical precancers, first I will let you know the definition. What do you mean by cervical precancers? Then I will let you know the most common age of presentation, then the etiology, the risk factors for these cervical precancers. Then we will see the three important classification system on which frequently question comes in your exam. So the first classification we will see is carcinoma in situ, CIS system. The second classification we will see is cervical intraepithelial neoplasia, that is CIN, CIN, cervical intraepithelial neoplasia, CIN 1, CIN 2, CIN 3. And final, the third classification which is presently used, we see the Bethesda system, most important, on which very frequently question comes in your exam. So we will see the classification one by one. Let's start it. So have a view on this overview. If the question is coming in your exam, you have to write all these in the sequence only. So that's why overview is important, not only in this session, but in all sessions. So let's start the normal anatomy and histology of the cervix. So what is cervix? In the female genital tract, let me draw the female reproductive system or the female genital tract. So here I am drawing the uterus, here I am drawing the cervix, and here I am drawing the vagina. So you can see cervix is the organ which connect the uterus and the vagina. You all can see this is uterus, this is vagina. So connection between the uterus and the vagina is the cervix. So cervix is the organ which is connecting the uterus and the vagina. Cervix have two os. This is known as internal os and this is known as external os. Internal os is the connectivity between the cervix and the endometrial cavity of the uterus, and external os is the connectivity between the cervix and the vagina. So this is the normal diagram. Now let me ask you a question. What is the lining? What is the mucosal lining, epithelial lining of the cervix? Do you know that? Okay, let me give you a clue. What is the lining of the uterus and what is the lining of the vagina? So lining of the uterus is columnar epithelia. Let me draw the columnar epithelia here. So uterus is lined by columnar epithelia. We all know that. So this is the lining of the uterus. And what is the lining of the vagina? Vagina is lined by squamous epithelium. So here I am drawing the squamous epithelium. Now let me ask you the question, what is the lining of the cervix? Is it same as that of uterus, that is columnar? Or is it same as that of vagina, that is squamous? So wait, let me answer you this question. So we divide the cervix into two portions, upper half and lower half. So upper portion is the continuity of uterus, that's why the lining is columnar. And lower part is the continuity of the vagina. That's why the lining is squamous. Like the vagina, only the lining is squamous. So we divide the cervix into two parts. The upper part of the cervix is known as endocervix because it is interior, and the lower part of the cervix is known as ectocervix because it is exterior to the vaginal opening. So ectocervix and endocervix. So we got it that endocervix is lined by columnar epithelia. We all can see that. And ectocervix is lined by squamous epithelia. We can see that also. So this is the lining of the cervix. So I guess you got the lining. We got the normal anatomy, normal histology. So same thing is written in front of you. Here in this diagram also, you can see this is the uterus. You can see this is the vagina. And you can see the connectivity between the uterus and the vagina. This one is the cervix. In the cervix, there are two os, as I told you. This is internal os. This is external os. Internal os is connecting between endometrial cavity and the cervix above, and external os is the opening in the vagina below. So this is internal os, this is external os. You can see that. Now in the histology, the same thing I shown you. So you can see uterus is lined by columnar. So the ectocervix is same as that of uterus, that is columnar. And the endocervix, the endocervix is same that of uterus, that is columnar. And the ectocervix is same as that of vagina, that is squamous epithelia. So you can see it well. So ectocervix is lined by the squamous epithelia and endocervix is lined by the columnar epithelia. So this is the basic we have learned. Now let's start the topic. You don't have to write this in your exam. This is for your understanding. Now if you have understood it, let's start the topic. Cervical precancers. So as the name indicates, the precancers are the pre-malignancies. Cervical precancers leads to cancer of the cervix. So this is the precancers. So it is a spectrum of certain intraepithelial changes which are taking place in the cervix. It starts with minimal atypia and gradually it progresses towards carcinoma. So these are the precancers, precursors that leads to malignancy in the cervix of the female. Age usually it occurs in young or middle age, less than 40 years. So see the definition, see the age. Now coming on the etiology. Etiology means risk factors. What are the risk factors of cervical precancers? There are two risk factors. The most important risk factor is the virus. The name of the virus is human papilloma virus, HPV. Human papilloma virus. And second is multiple environmental factors. So most important risk factor, human papilloma virus. Human papilloma virus is the most common risk factor for the cervical precancers as well as cervical cancer. The precancer and cancer, the risk factor for both is HPV. It is one of the DNA virus which is sexually transmitted, the HPV virus. Now, what are the risk factors of HPV virus infection? There are 5 risk factors. Any female who is having multiple sexual partners is at high risk of having HPV infection. Any female who is having first sexual intercourse at young age before the age of 18 years, she is at high risk of developing HPV infection. Any female who is having high parity, multiparity. So whenever the female become pregnant, there is a female who is pregnant. So every time she is having the vaginal delivery. So when the fetus, the newborn is coming out of the reproductive tract of the mother, there is a stress on the cervix. Now, if it is happening multiple times, maybe 10 times, 20 times, she is becoming pregnant multiple times. So every time there is a stress over the cervix and it can lead to cervical precancers. So high parity is a risk factor. So a female partner is having a male sexual partner and the male partner is having multiple previous sexual partners. That female is also at high risk. The female partner who is having a male partner and the male partner is having multiple sexual partners, not the female one. So female herself is having multiple sexual partners, that is also a risk factor, and having a male partner who is having multiple sexual partners is also a risk factor. And insufficient immune system, that is a risk factor. So these are the risk factors for human papilloma virus. Now human papilloma virus is of more than 100 types. There are various types of HPV. We divide them into 2 categories. What are the 2 categories? Low risk HPV and high risk HPV. Low risk HPV leads to benign cancers. Benign cancers which are known as warts. So they lead to benign genital warts, also known as condyloma acuminata. And the high risk HPV, they leads to malignant cancers in the genital. So in female, they leads to cervix cancer. In males, they lead to penis cancer. So that is the high risk. So I told you HPV is more than 100 types. So the benign one are serotypes 6 and 11. 6 and 11 are always benign. They lead to low risk HPV, they lead to benign cancers, that is warts. And high risk, learn the most important 16, 18, 31, 33, 45. Learn these 5, at least these 5. If you can learn more, after that there is 52, 56, 58, 59 and 68. They lead to cancers, the malignancies. So they lead to squamous cell carcinoma of the vagina, vulva, penis, anus. So they lead to multiple cancers of the multiple sexual organs, the genital organs. So that is the types of the HPV. So what are the types of HPV? HPV is more than 100 types. We divide them into 2 categories. What are the 2 categories? Low risk HPV and high risk HPV. What do you mean by low risk HPV and high risk HPV? What do you mean by that? Low risk HPV leads to benign cancers, that is warts. And high risk HPV leads to malignant genital cancers in male and female. So among more than 100 types, the low risk is always 6 and 11. Subtype 6, subtype 11. In the high risk, it's 16, 18, 31, 33, 45. After that, there is 52, 56, 58, 59, 68. You can learn these also, but these 5 are ultra important. So that is the type of HPV. Now you tell me, how does HPV is causing oncogenesis? How does it is leading to cancer? So let me draw a genital cell. This is a cell of the genitalia. Maybe the male, if the male is there, this is the penis cell, and if the female is there, this is the cervix cell. This is the nucleus of the cell, inside which this is the DNA. This is a human cell. This is a host cell, the human cell. Now, due to sexual intercourse, this person is having HPV infection from the partner. So this is HPV virus. This HPV virus enters in the host cell. After entering in the host cell, this HPV virus forms two proteins. What are the name of the two proteins? E6 and E7. Please learn the name of the two proteins. This HPV is forming two proteins. This E6 and E7 goes in the nucleus of the human cell. It will go in the nucleus of the human cell and cause mutations. Mutation of which gene? So E6 causes mutation, E6. It leads to mutation of P53 gene, and E7 leads to mutation of retinoblastoma gene. And because of the mutation of these genes, the P53 gene and retinoblastoma gene, this cell become immortal, and it will lead to uncontrolled mitosis. Uncontrolled mitosis, I mean this cell become a cancer cell, because of which this cell become cancer cell. It will do uncontrolled mitosis, it is immortal, it leads to malignancy. So this is the mechanism. So can you tell me the mechanism again, what is happening? So this is the human cell, this is the human genital cell. So HPV virus is entering via sexual intercourse. This HPV virus enters the human cytoplasm, human cell cytoplasm. It will form two protein, E6 and E7. E6 and E7 protein of the virus enters in the nucleus of the human. And after entering in the nucleus of the human, E6 causes mutation of P53 gene and E7 causes mutation of retinoblastoma gene. Now in your exam, you get confused that E6 and E7, they are causing mutation of which gene? You can do the reverse exam by mistake. So there is a way to learn. RB, retinoblastoma. Let's say RB is rainbow. Rainbow, RB. Rainbow have 7 colors, and you can learn E7. So this is how you can learn. E7 leads to mutation of RB. RB is rainbow. And E6 is leading to the mutation of the P53 gene. So this is how I learned, and I never forget by this technique. So this is how oncogenesis occurs by HPV virus. The same thing you can see it here. So HPV virus, after entering the human cell, it is forming the two proteins, E6 and E7. E6 causes mutation of P53. E7 causes mutation of retinoblastoma. They cause mutation of other genes also, but not important. Like E6 causes, along with P53, it causes mutation of TERT also, but if you don't learn, it's okay. And E7 along with retinoblastoma, it causes mutation of P23 also. So ultimately, immortalization of the cell, uncontrolled cell division, uncontrolled cell proliferation, that converts this cell as a cancer cell. And it will lead to cancer, the cervix cancer in the female and the penis cancer in the male. So this is the oncogenesis. I'm teaching you the risk factors. Now coming on the environmental, as I told you, there are two risk factors now. HPV. So for HPV, we have seen the types, the risk factors for the HPV infection. We have seen the types of HPV infection, I mean low risk and high risk, and we have seen the mechanism, how does it causes the oncogenesis. Now I'm coming on the environmental factors. What are the environmental factors which leads to cervix precancer? What are the environmental factors? There are 5 environmental factors. In the environment, there are many carcinogens present. Smoking is the biggest risk. Imagine a female who is a chronic smoker. Imagine a female who is a chronic smoker. What does the smoke contain? Smoke contains polycyclic hydrocarbons, and it acts as a carcinogen, and it can lead to cervical precancers and cancers. Coexistence of microbial infection. So the female is having HPV infection. Along with that other microbial infection, she is at high risk of developing the cervical precancer. Dietary deficiencies, hormonal changes, and use of OCP. OCP increases the risk of cervical cancer, cervical precancers and cancers. So we have seen the risk factors. So I'm teaching you a topic that is cervical precancers, the pre-malignancies or precancers of the cervix of the female. I taught you 3 things till now. What is the definition? What is the age group? And what is the etiology? Etiology or risk factors. So I told you what is the definition. So these are the precancers, the pre-malignancies. It's a spectrum of changes. It's not the malignancy happen in one day. No, it's a spectrum of changes which occurs over years. So it starts with minimal ATPR and gradually, if not treated, it get progressed to malignancy, the cancer. So that is cervical precancer. What is the age? It occurs in young age or middle age, less than 40 years. And what is the etiology? There are two risk factors. The most important risk factors is HPV virus, and second is environmental factors. In HPV, you have to explain everything. What is the mechanism? How does HPV causes malignancy? What are the types of HPV, low risk, high risk? And that's all about it. And in the environmental, you have to enumerate various environmental factors like smoking, like environmental pollution. You have to enumerate the risk factors like dietary deficiencies, hormonal changes, OCPs. So these are the environmental risk factors. Now, so we have seen the definition, age and classification. Now we have to understand the three type of classification of cervical precancers, the ultra important thing. So let me tell you the three type of classification of cervical precancers, the three different systems we will discuss here. The first is carcinoma in situ, CIS, carcinoma in situ. So CIS, here we divide the cervical precancers into three categories: mild dysplasia, moderate dysplasia, severe dysplasia. You may be thinking, ma'am, what is dysplasia? Many students even don't know, ma'am, dysplasia. What do you mean by dysplasia? So before understanding this, you understand what is dysplasia. So first, where we are talking about? We are talking about the cervix. Can you see this diagram? I have explained you the cervix. So what is the lining? You tell me what is the lining of endocervix and what is the lining of the ectocervix? Endocervix is lined by columnar epithelia and ectocervix have squamous epithelia. So here I am showing you, see this diagram. This one is squamous epithelia. Okay, so you may be thinking it is ectocervix. The ectocervix is having the squamous epithelia. It can be ectocervix, but sometimes it can be endocervix. In the endocervix, the columnar epithelia is transformed to squamous by metaplasia. So we are talking about this zone. So whatever diagrams I will show you, please understand, I am talking about the cervix. I'm talking about the cervix. You can see this is normal cervix lining. This diagram is normal. You can see the normal squamous lining. Normal squamous lining, which is in multiple layers. It's normal. In multiple layers, only the squamous lining is occurring. So this layer is known as basement membrane. What does it known as? This is the basement membrane, the basal cell, and this is basement membrane. This one is basement membrane, and it is multiple in layers. That is stratified. Stratification means in multiple layers. So stratified squamous epithelium. This is the normal lining of the cervix. Now I will explain you what is dysplasia. Then you will understand mild, moderate and severe dysplasia. So first classification you will understand. So we are talking about dysplasia over here. So please imagine we are talking about the cervix. Okay. So you have to understand the cervical in situ system, that is CIS system. You have to first understand dysplasia. So what is dysplasia? Any cell showing the 5 features is a dysplastic cell. So any cell which is having these 5 features, that cell is known as dysplastic cell. What are the 5 features? Please understand. Now imagine this is normal cell. This is normal cell, and this here I'm showing you anaplastic or dysplastic. Dysplastic or anaplastic cells here I'm showing you. So let me explain. So I will draw it for you rather. So you can see this is a cell. You can see here, this is a cell which is normal. These are the normal cells I am drawing. And here I am trying to draw the dysplastic cells. I am trying to draw the dysplastic cells this side. Now normally the nucleus is towards the basement membrane. Normally the nucleus is not in the center. The nucleus is towards the basement membrane. But in dysplasia, nucleus is away from the basement membrane. It is enlarged, number one, and it is away from the basement membrane. So this is the first feature of dysplasia. What do you call this feature? Let me explain. So normally the nucleus is towards the basement membrane. We call it basal polarity. Basal polarity means the nucleus is towards the basement membrane. Basement membrane is basal. Polarity means towards that pole. North pole, south pole. So normally basal polarity is present. But in dysplasia, the basal polarity is lost. I mean the nucleus is not towards the basement membrane, it's away from the basement membrane. So the first feature of dysplasia is loss of basal polarity. Number one. Number two, here you can see all the cells are same shape, same size normally. And here some cells are large, some are normal, some are small. So that is known as pleomorphism, variation in shape and size. So here we don't see any pleomorphism, no variation in shape and size. So morphism is absent here. But here pleomorphism is a feature. In dysplasia, pleomorphism is present. So basal polarity is lost, but pleomorphism is present. So you can see that also, the pleomorphism. Okay. Now inside the nucleus, see, there is no mitosis here. You can see there is no atypical mitosis normally. But here in some of the cells, you can see the spindle formation and you can see the mitosis here. So here we don't have any mitosis. Atypical mitosis is absent here. Here frequently we get the atypical mitosis. You have to learn that, the atypical mitosis. Now see the color of the nucleus. Here, if we see the color of the nucleus, it's normal color. It's normal color. But here the nucleus become more compact. More compact. The chromatin become more compact. So nucleus become more dark in color. More dark in color. So color is known as chroma. The color is known as chroma. Chromatism. Chromatism in pathology means color. So here the chromatism is normal. Normal color. Normal chromatism. Here it is hyperchromatism. So hyperchromatism is a feature of dysplasia, the fourth feature. And finally, the last feature is NC ratio. The fifth and the last feature is NC ratio. What do you mean by N and C? N is the numerator, C is the denominator. N is the size of the nucleus and C is the size of the cytoplasm. See, normally size of the nucleus and size of cytoplasm. See, size of nucleus here and size of cytoplasm. This is normal. So you can see nucleus is small in size and cytoplasm is large in size. See, nucleus is very small. Cytoplasm is very large. See, in the dysplasia, you can see the nucleus is enlarged, but cytoplasm is not that much enlarged. So your nucleus is more, but cytoplasm is less. So what happens to NC ratio? In dysplasia, the numerator is increasing. I mean, the nucleus is increasing, but denominator is not increasing. So overall NC ratio is raised in dysplasia. So what are the 5 features of dysplasia I have shown you in the diagram? Number 1, the basal polarity is lost. Number 2, pleomorphism is present. Hyperchromatism is present. Mitosis is increased or present. And NC ratio is high. There is high NC ratio because the numerator is increased. So these are the 5 features of dysplasia. Any cell showing this 5 feature is dysplastic cell. Now you please enumerate what are the 5 features of dysplasia. Any cell in human body having the 5 features. If any cell basal polarity is lost, the basal polarity of that cell is lost. That cell is hyperchromatic. I mean the nucleus is dark color. Hyperchromatism is present. The shape and size is different. Pleomorphism is a feature. Pleomorphism is present. Okay, mitosis, atypical mitosis are very frequent and NC ratio is high. So any cell having these 5 features is known as dysplastic cell. Now currently I am interested in cervix. So we will talk about the cervix. This is normal cervix. Now please have a look, please understand. This topic is really very difficult. Please understand, you can see here, this is normal epithelia of the cervix. This is normal epithelia. Now here we can see mild dysplasia. What do you mean by mild dysplasia? What do you mean by mild dysplasia? You can see out of the total thickness of the cervix where multiple layers are there, 1/3 thickness is showing dysplasia. See, this is out of the total, this is 1/3. Can you see this area? This is 1/3. Now, the cells in this 1/3 thickness are dysplastic. They are showing the 5 features. You can see they have lost their polarity. They are hyperchromatic. Their NC ratio is more. They are showing pleomorphism. They are showing some of them as mitosis. But these cells are normal. These cells are normal. You can see these are the normal cells. So dysplasia, it is known as mild dysplasia. What do you mean by mild dysplasia? I mean out of the total thickness, the dysplasia is present in 1/3. The dysplasia is present in 1/3 of the thickness, the cells of 1/3 of the thickness. So there are multiple layers. So out of the total thickness, the 1/3 of the cells are showing dysplasia. That is mild dysplasia. Moderate dysplasia, 1/3 to 2/3. More than 1/3 but less than 2/3. So out of the total thickness, at least 1/3 to 2/3 cells, 1/3 to 2/3 thickness cells are showing dysplasia. Those 5 features, but the remaining are normal. A little bit is normal. See the normal here and see the normal here. Here dysplasia is less, but normal is more in mild dysplasia. In moderate, the dysplastic zone increases and normal reduces. What is severe dysplasia? More than 2/3. More than 2/3. You can see more than 2/3 is dysplastic, showing those 5 features, more than 2/3. And sometime more than 2/3, if it become complete, if it become through and through dysplasia, through and through, all the cells are dysplastic, it is known as carcinoma in situ. It is known as carcinoma in situ. So the severe dysplasia is only carcinoma in situ. More than 2/3 and more than 2/3 is full thickness. Sometimes it is full thickness. So full thickness dysplasia is carcinoma in situ. So I hope you are getting it. Yes. And till now, in all of them, whether it is mild dysplasia, moderate dysplasia, or severe dysplasia, please understand the basement membrane here. The concept of the basement membrane. Can you see the basement membrane? This is the basement membrane. This is the normal basement membrane. In all the diagram, appreciate the basement membrane. So what I said, so this is normal. Here, this is normal. All the cells are normal. See the first diagram. In the second diagram, see this portion is dysplastic. That is less than 1/3. In the second diagram, this is mild dysplasia. In the moderate dysplasia, 1/3 to 2/3 is dysplastic. 1/3 to 2/3 is dysplastic, but rest is normal. In severe dysplasia, more than 2/3 is dysplastic. And in carcinoma and situ, through and through is dysplastic. So we have understood. But in all of them, the basement membrane is intact. The basement membrane is intact. The dysplastic cells are present in epithelium only. Now, the basement membrane is breached and the dysplastic cells are coming downward into the stroma. They are rupturing, they are breaching the basement membrane. Can you see this is the basement membrane? Please appreciate the basement membrane. Here the basement membrane is breached and you can see the dysplastic cell. Full thickness is already there. Now the dysplastic cells are breaching the basement membrane and coming in the stroma. It is no more precancer, it is malignancy. It is malignancy. It is cervical cancer. These are the precancers. So precancers are of three types. Mild dysplasia, moderate dysplasia, severe dysplasia. Mild dysplasia means dysplasia present in less than 1/3. Moderate means 1/3 to 2/3. And severe means more than 2/3 or full thickness. After full thickness, it is carcinoma. So these are the stages. First, in the cervix, mild dysplasia occur. Mild dysplasia leads to moderate dysplasia. It will progress to moderate dysplasia. Moderate will progress to severe dysplasia. Severe will progress to carcinoma in situ. And finally, it will lead to carcinoma. What do you mean by that? Mild dysplasia means dysplasia in less than 1/3 of the thickness out of the total thickness. Moderate means it is the dysplasia is between 1/3 to 2/3 of the thickness. Severe is more than 2/3 of the thickness is dysplastic. Carcinoma in situ is full thickness dysplasia, but there is no basement membrane breached in any of them. Here, breach in basement membrane. There is a breach in basement membrane. I hope you are getting it. Mild is less than 1/3 of the dysplasia. Moderate is 1/3 to 2/3 thickness of the dysplasia. Severe is more than 2/3. And if the severe only become full thickness, it is carcinoma in situ. So severe and carcinoma in situ are one and the same actually. Okay, and once it is breaching the basement membrane, it is known as carcinoma. So the precancer lesions. Currently my topic is not carcinoma. My topic is precancer. So these are the precancer. Mild, moderate, severe dysplasia. And severe dysplasia only is carcinoma in situ. That is the first classification I'm telling you. And we are talking all about in the cervix. Please imagine it. I mean, this is the uterus. This is the cervix. And this is the vagina. Okay, this is the vagina. So you can see the ectocervix or the endocervix. The endocervix is lined by the columnar epithelia. Okay, and the ectocervix is lined by the squamous epithelia. I have explained you can understand this. Now the squamous epithelia is multilayered. The squamous epithelia is multilayered. So it is already multilayered. But sometimes the columnar epithelia also transform. This columnar epithelia, sometimes it shows metaplasia and it will also transform. It will also transform into squamous epithelia. So we are talking about the cervix. You can see the multiple layers. You can see the multiple layers. Now please appreciate the basement membrane here. This is the basement membrane. This is the complete basement membrane. Now this is epithelia. Just below the epithelia we have, this is mucosa. We have submucosa. We have muscularis propria, serosa. We have submucosa, muscularis propria, serosa. So dysplasia starts. How does the dysplasia start? If we say the dysplasia is confined to the lower 1/3, we will say it is mild dysplasia. If it is 1/3 to 2/3, moderate. If it is more than 2/3, its full thickness, that is severe dysplasia. And then it breaches the basement membrane. And if it is progressing, the dysplastic cells progressing into the submucosa, it is known as carcinoma. So this is how it takes place. You got my point? So first dysplasia starts from here. It's mild. Only 1/3 is involved. Then it progresses and it becomes moderate. 2/3 is involved. Then it progresses, it becomes severe. More than 2/3 or full thickness, it is there. Then it breaches the membrane and the dysplastic cells enter in the submucosa and muscularis propria. It is carcinoma. So I hope you are getting it. We are talking about that diagram in this terminology. I mean, in this aspect, you have to imagine that this all is taking place inside the cervix. So you have to understand this all is taking place inside the cervix of a female. These are the precancers. So we have to treat the female before it converts into malignancy. So we have to fix it at mild, moderate or severe dysplasia before she presents in malignancy. This is the first classification. So you tell me what is mild dysplasia, what is moderate dysplasia, what is severe dysplasia? Mild dysplasia means when out of the total thickness, 1/3, less than 1/3 is dysplastic. Moderate is 1/3 to 2/3 is dysplastic. And severe is more than 2/3 is dysplastic. Sometimes when it becomes full thickness, entire thickness dysplasia, severe dysplasia convert into carcinoma in situ. And when there is a breach in basement membrane, it will convert it to carcinoma. So that is the meaning. So you can see it here. So you can see here 1/3 is dysplastic. You can see you can see out of the total thickness, you can see this is the total thickness which is normal. Here out of the total thickness, this portion is dysplastic, that is 1/3. Here out of the total thickness, this portion is dysplastic, that is 2/3, 1/3 to 2/3. Here out of the total thickness, complete thickness or more than 2/3 is dysplastic, that is severe dysplasia. And then the breach in the basement membrane, and they are coming into the stroma, the submucosa musculus propria, that is the thing. So concepts are crystal clear. So we have seen one classification. So first classification was carcinoma in situ. We have done that. We divided them in 3 categories: mild, moderate, severe dysplasia. Now coming on the second classification. So second classification is cervical intraepithelial neoplasia, that is CIN, cervical intraepithelial neoplasia. It's one and the same thing, like dysplasia only. So we replace the terminologies. Here instead of mild dysplasia, we call CIN1. Here instead of moderate dysplasia, we call CIN2. And instead of severe dysplasia, we call CIN3. It means that the definition of CIN1, here the dysplasia is in less than 1/3 of the thickness. In CIN2, the dysplasia is 1/3 to 2/3 of thickness, and in CIN3, it is more than 2/3 or full thickness. So the same thing is there. The mild dysplasia is replaced by CIN1, the moderate dysplasia is replaced by CIN2, and the severe dysplasia or carcinoma in situ, this term is replaced by CIN3. So it is the replacement of the terms. That's it. The meaning is the same. So here you can see in CIN1, less than 1/3 is dysplastic out of the total thickness. In CIN2, 1/3 to 2/3 is dysplastic out of the total thickness. And in CIN3, full thickness is dysplastic out of the total thickness, or more than 2/3 is dysplastic. So that is CIN1, CIN2, CIN3. What is CIN? Cervical intraepithelial neoplasia. So now initially we use the term dysplasia, but nowadays we don't use the term dysplasia, mild, moderate, severe. We use the term CIN1, CIN2, CIN3. So it is just replacement of the term. So that is the thing. So basically CIN1 leads to CIN2, CIN2 leads to CIN3, and CIN3 leads to carcinoma in situ, and carcinoma in situ leads to cancer. So you can see CIN1, CIN2, CIN3. That is mild dysplasia, moderate dysplasia, severe dysplasia. If some lady is having CIN1, 60% of the chance she will become normal if treatment is given, and less than 1% of the chance it will convert into malignancy. If the lady, any female, is having CIN2, 40% of the chance she will become normal, but 5% chance increases, she will become malignancy of the cervix. If some female is having CIN3, only 30% chance she will become normal, and 20% chance she will have the malignancy. The remaining, it will remain as same. So that is the meaning. So you have to learn, as CIN1 progress to CIN2, progress to CIN3, the chances of malignancy are increasing. If the female is taking the treatment at CIN1 only, less than 1% of the chance she will have malignancy in future in the cervix. If she is taking the treatment at CIN2 stage, 5% chance she will have malignancy in the future. And in CIN3, there is 20% chance. So I hope you got it. So out of the 3 classification, 2 are done. We have seen cervical in situ classification, that is dysplasia classification, mild, moderate, severe. And we have seen CIN classification, CIN1, CIN2, CIN3. So mild dysplasia is CIN1, moderate dysplasia is CIN2, and severe dysplasia is CIN3. Okay, now coming on the latest classification, the last classification, the third classification, Bethesda system. Here we don't use the term dysplasia, no. We don't use the term CIN, no. We use a separate term, that is SIL, that is squamous intraepithelial lesion. SIL, we use the term SIL. We don't use the term CIN, no. Cervical intraepithelial neoplasia, no. We use the squamous intraepithelial lesion, that is SIL. Because many people said that this term is not good, because we are talking about cervical intraepithelial neoplasia, but it's a misnomer. It's not neoplasia. It's a pre-malignancy. It is CIN1, CIN2, CIN3. None of the CIN is neoplasia. So we replace the term by SIL. So rather than calling it neoplasia, we call it a lesion. We call it a lesion. Okay, it's not neoplasia because it is a precancer. It's not cancer. It is not neoplasia. It's pre-neoplasia, you can say. So this terminology was not very good. So many scientists propose that we should replace the term of CIN with SIL. So in CIN, N is neoplasia. It is not a neoplasia, it's a pre-malignancy. So we are replacing it with SIL, squamous intraepithelial lesion. So better to call it a lesion. Better to call it a lesion. But it is a 2-tier system. Here we divide into 2 categories. Low SIL. Low SIL is LSIL, L for low, and high SIL, HSIL, H for high, H for high. So we divide them in 2 categories. So you'll see, ma'am, what do you mean by that? So CIN1 or mild dysplasia is low SIL, and CIN2 and 3 together, CIN2 and CIN3, CIN2 and CIN3 together are HSIL. That is moderate and severe dysplasia and are an HSIL. So instead of 3-tier system classification, we convert it into 2-tier system classification. That is Bethesda. So in Bethesda system, we have only 2 categories: low SIL, L for low, and high SIL. So LSIL and HSIL. So here we include CIN1, that is mild dysplasia. Here we include CIN2 and 3, that is moderate and severe dysplasia, and Carcinoma and situ also. So the finally 3 classifications are in front of you. See the normal thickness. See the normal thickness of the cervix. We are talking about cervix. Imagine the diagram. So all the changes which I am telling you here, please imagine that in the mucosal lining of the cervix. So here you can see I am drawing the mucosa of the cervix. So you can see we are drawing the stratified squamous epithelia of the cervix. So all the changes which I am enumerating, mild, moderate, severe, we are talking about this lining, about the thickness of this lining. So please imagine that. So this one is normal. This one is normal. You can see if the dysplasia is in less than 1/3 out of the total. Less than 1/3 are dysplastic. You can see now these cells are normal. You can yourself see in the diagram, it's visible. No need to say. Compare all these cells throughout the thickness. You yourself make out, ma'am, these cells have high NC ratio, they have loss of polarity, they have pleomorphism, they have mitosis. So these are dysplastic cells, but the remaining cells are normal. So it is less than 1/3. So either you call it mild dysplasia, or you call it CIN1, or you call it LSIL. The meaning is the same. The meaning is the same, but the classifications are different. Here, this classification is CIS classification, this classification is CIN classification, and this classification is Bethesda classification. But the meaning is same. So whether I called mild dysplasia, I called CIN1, I called LSIL, the meaning is the same. It means that out of the total thickness, the dysplasia is confined to the less than 1/3. If the dysplasia is 1/3 to 2/3 out of the total, 1/3 to 2/3, either I will call it moderate dysplasia, or I will call it CIN2, I will call it CIN2, or I will call it HSIL, which includes CIN2 as well as CIN3. So, and if the dysplasia is throughout the thickness, more than 2/3 or throughout the thickness, you can see, or more than 2/3. So either I will call it severe dysplasia, or I will call it CIN3, and it is also included in HSIL. So HSIL is including CIN2 and CIN3, or moderate and severe dysplasia. So I think this diagram is crystal clear. The 3 classification systems are in front of you. I guess you all are getting the 3 classification systems which are written in front of you. So the first classification you can see in front of you. The first classification is dysplasia, mild dysplasia, moderate dysplasia, severe dysplasia. This is the first classification. The second classification is CIN classification. Mild dysplasia is replaced by the term CIN1, moderate dysplasia is replaced by the term CIN2, and severe dysplasia is replaced by the term CIN3. And the third and the last classification, the Bethesda, it is a two-tier system. So here mild dysplasia or CIN1 is replaced by LSIL. It is replaced by LSIL, and moderate and severe together, that is CIN1, CIN2 together, is known as HSIL. So I hope the concepts are crystal clear and the diagram remains same for all of them. So this is the summary. So we have seen 3 classification systems. The first is WHO classification, the second is CIN classification, and third is Bethesda. First, learn the name of the classification categories. What are the 3 classifications we are having? We are having WHO classification, CIN classification, Bethesda classification. WHO is the 3-tier, mild, moderate, severe dysplasia. CIN is also 3-tier, CIN1, CIN2, CIN3, and Bethesda is the 2-tier, LSIL and HSIL. And you should write the definition. So mild dysplasia, CIN1 or LSIL, the definition is same. Dysplasia is in lower 1/3. Dysplasia is in the 1/3 of the thickness out of the total. Moderate dysplasia, CIN2, the definition is same. It's in 2/3, 1/3 to 2/3. And severe dysplasia and CIN3, it's more than 2/3 or full thickness, more than 2/3. CIN2, CIN3 together known as HSIL. So that is the thing. And full thickness dysplasia is known as Carcinoma and situ. So I hope the concepts are crystal clear, and this is the real diagram. You can see. Can you see the normal thickness of the stratified squamous epithelium? This is normal. Can you see this portion is dysplastic now? This portion become dysplastic, but the upper portion is normal. It's less than 1/3, so CIN1. You can see here this portion is dysplastic. It's 2/3, and here you can see complete dysplasia. Complete dysplasia is CIN3. So you can appreciate that. I hope you got it. So whenever a person is having, a female is having HPV infection. So first HPV infection. Now HPVs are of 2 types, the low risk, high risk. If it is low risk, that is 6 and 11, it will lead to warts. The condyloma acuminata, that is benign warts. But if it is high risk HPV, that is 16, 18, 31, 33, 45. So first it will lead to LSIL, then it will lead to HSIL, then it will lead to carcinoma. So first it will lead to CIN1, CIN2, CIN3, and then it will lead to carcinoma. So if we detect the abnormality at CIN1 stage only, CIN2, CIN3, we can treat the female before she presents with carcinoma. That is the meaning of the precancer. We are done. So if this topic is coming in your exam, you have to write the definition of the precancer. This is not cancer. This is before malignancy. Age is young age, less than 40 years. Etiology, there are only two risk factors, HPV, number one, and environmental factors. And you have to write down three classification system. What are the three classification system? The first is dysplasia, WHO classification, mild dysplasia, moderate dysplasia, severe dysplasia. The second classification is CIN classification, CIN1, CIN2, CIN3. And third is Bethesda. You get a separate question on Bethesda. Short question. Please write down that. So this is a two-tier system, LSIL, HSIL. So mild dysplasia is equal to CIN1 is equal to LSIL. Moderate dysplasia is equal to CIN2, severe dysplasia is equal to CIN3, and CIN2, CIN3 equivalent to HSIL. So you have to write that. That's all about it. Don't forget to have a look on the previous year university exam, long, short, very short questions and MCQs of this topic, which are asked in the previous year university exam, which is given in the notes section and question bank section. Thank you.